Now there is a warning. This is the insert from the oestrogen patches and gels, and even the vaginal oestrogen as well. And I am not going to read it to you, but if you look at it, it will tell you, and it's telling me now, that there's a risk of clot, there's a risk of raised blood pressure, there's a risk of heart disease, there's a risk of breast cancer in this. And actually there isn't any evidence for that. We know that oestrogen through the skin as the patch or gel has no risk of clot, because all it's doing is going straight through the skin into the bloodstream. The older types of preparations, that the tablet oestrogen, are thought to activate the liver clotting factors, because anything that goes into our mouth gets metabolized through our liver. That's what our liver does, and the liver also produces clotting factors. So there's about a double risk of clot with people who take oral oestrogen. It's still a small risk. People usually have a small risk of clot, so a small risk is still a small risk, but actually it's better to have something with no risk. Now the whole risk with breast cancer, I will tell you again, and I'll keep saying it because it's really important to know. Estrogen on its own has actually been shown to be associated with a lower risk of breast cancer, around 23% lower risk when the WHI, the Women's Health Initiative study, was followed up over 20 years. Estrogen is very anti-inflammatory, so it's known to reduce the risk of breast cancer. So it doesn't increase the risk of breast cancer in any studies that we know. So this leaflet actually isn't right. We also know that women who take HRT have about a 50% lower risk of cardiovascular disease. Estrogen is very anti-inflammatory on the lining of the blood vessels. It reduces atheroma. It also reduces the LDL, the bad cholesterol in our bodies as well. And I don't know when they're going to change it, but it's incredibly frustrating that our inserts are not based on science.